Yo guys, welcome to our video again. This is Future Talks channel. When you see me with this stethoscope, it matters medical. And today we are going to talk about something very special. Have you ever heard of fibroids or uterine fibroids? That's what we're going to talk about today. Uterine fibroids are very common, especially when you look at the causative or the causes of this. Mostly you get that here in Africa. uh, Race is one of the predisposing factor of this kind of a condition. So you get that these uterine fibroids are very common with the black people, especially the black women. We know women are the one who have the uterus, and the uterus is where a baby normally grows, or after conception in the fallopian tubes. You get that the now the embryo moves to the uterus, where it gets formed. So the uterine fibroids uh, are what we call myomas or leiomyomas, which are muscular tumors that can grow in the uterus. So from the definition, we get that these fibroids are leiomyomas or tumors which grow in the uterus, and normally they are not cancerous. So they grow, and normally they grow in the women who are in the reproductive age. Reproductive age means from when one breaks or one starts to get the periods to the time when it stops. The period between that, if the woman is productive and can conceive or get pregnant. So, and normally these uterine fibroids, from the theories given, they are controlled by hormones, especially the progesterone and also the testosterone, which also are the hormones of pregnancy, or which control the pregnancy. So there is a way these fibroids take advantage of that, and they may grow into certain kind of uh, bring about the problem. But normally this age of 30 to 40, that's when they start appearing in women especially. So like you get the doctor advising the women to normally get pregnant at that before that age, so that they may avoid a lot of problems about the fibroids. So how does one know that the one has a problem with the also one has fibroids? Normally, it is very difficult to determine, because most of these condition, most of the time, you get that the lady cannot tell if he or she has them. But when you get when they are on the extreme, or when they are now problematic, or they can bring about problems, so that they may have someone having heavy, prolonged, or painful periods. Prolonged, like if somebody used to have the periods for 1 to 2 days or 3 days, it can prolong up to 7 days. That's a sign of maybe somebody has developed those periods. And somebody may also have the dysmenorrhea or painful periods. uh, so it can be a sign of having those fibroids. Also, because the uterus is between the rectum and also the bladder. Uh, the bladder is where which stores the urine. That's where we urinate from, especially for the female. And from the rectum side, that's where also where we get to get the waste out. So when especially those uterine fibroids overgrow, they bring about some changes, which may bring pressure to the anal area or the rectum area. And also someone also may have also on the front part of it may have problem with the urination, and also painful urination, and other problems, especially when the bladder is somehow full, so it brings about some problems for the lady. Like I mentioned, what can cause uterine fibroids? Uh, they say most of the time these are theories which come up about telling about the fibroids. Uh, they say most of the time it is hormonal and a genetical, maybe the main cause of these fibroids. That is the hormones and the genetics. And hormones, we have what you call the estrogen and also progesterone. Which are the main hormones which make the lining of the uterus to be thickened during the every month. That is the estrogen and also the progesterone are the hormones which make ladies to have, especially to have the menses. So when we have a problem with the balance of this, you get that we have a problem with when these hormones can also, as they control the menstruation phases of the periods. Also, these hormones, when they are available, they say they also participate in getting those the uterine fibroids to grow. That's why we get that when a woman is between the productive age, is a problematic kind of a condition, because the hormones are there and there's no way one can do. So they participate uh, in the growth of those uterine fibroids. But that's why when someone gets into menopause, so the uterine growth is also affected, because in menopause the estrogen and also progesterone hormone is really reduced in the body. So another thing is genetics. They say if your sister, if your mother had them, you are likely also to develop them, but no particular studies have really gone specific and shown over the same. Like I said, these are the theories over the same. So other factors which may cause that kind of problems is when people with diabetes can also get, they're predisposed to get this kind of condition. They say people who are overweight, and also yeah, they can, people with a lot of sedentary life, especially the ladies, they're exposed to get that kind of problems. So you get that one of the we also have the risk factors which can cause a person to go into these uterine fibroids. We have age, like I said, within the reproductive age, between when one has the periods up to the time when it starts to go to the menopause, is a predisposing factor because of the hormones which are available for the growth of those fibroids. Race, I said about race is a risk factor, especially the black people or black ladies, black American, Africans who are black. Also, it is a predisposing factor to it. They also say getting your first periods at an early age can be a factor to getting those fibroids. They say eating a lot of too much red meat, and also not taking a lot of green vegetables can be also one of the causes. Also not taking fruits, and also uh, another thing is the alcohol. The people who love alcohol are predisposed to get those uterine fibroids. That is a factor, because now, especially now getting to the symptomatic part of it, you get that most of the ladies are affected by that, especially when once one takes a lot of that alcohol. Also family history. They say if your aunts, your mom had those fibroids, you get that also, you can get exposed to get into that problem. So how do you make a diagnosis for uterine fibroids? So when a doctor suspects that somebody has uterine fibroids, so he can do that through pelvic exam, and also find out that one has uterine fibroids. So the most common thing which a doctor does is to send the patient for ultrasound, where one checks on the size of the fibroids and also to determine how large they are. So from the ultrasound, one can determine, or the doctor can determine how big they are and how many they are and their location where they are, because depending on where they are and how big they are, that determines on the management of the same. Another thing which can be done, the doctor may do a WBC or a CBC, complete blood count, especially when the patients have what we call anemia. So to determine if the blood levels are okay. So on the lab levels, the white blood, the complete blood count can be very important to show how the fibroids are affecting the patient. Most of those people who have symptomatic uterine fibroids, or they have problematic uterine fibroids, they have low blood levels, because those fibroids are, like we said, they are tumors, and tumors supply themselves. They get vascularized. They get supplied with blood, which helps them uh, to get nutrients from the body. So instead of the nutrients getting to build other parts of the body, so those tumors get to feed a lot in the body. So another method which is very important also, it's what we call magnetic resonance imaging, or MRI, where also the doctor gets to find out uh, what is really happening there. We have other studies like hysteroscopy, so where the doctor inserts a telescope with lights attached to the cervix. So after injecting saline and expanding a uterine cavity, they can look on the walls of the uterus and also the fallopian tube opening, so that they can find out what is really happening. And also we have other methods which can be used to determine how big, or to look at those kind of the uterine fibroids. But most common, what we do here in Africa is to get ultrasound, and to some extent get the MRI, where the doctor gets to examine. Unless you are in the high-end hospitals, that's when something like a stresscopy can be done, also to check on what is happening with the patient. So there are various ways on how the treatment of fibroids is done. And there's something I want to give out about the disclaimer on the uterine fibroids. Uterine fibroids, all of those tumors, are not, most of the time, the leiomyomas or the myomas are not cancerous. So that is the good thing about them. They normally, most of the time, they are not cancerous unless somebody has a problem. So there are special medications which are given to suppress the growth of um, those fibroids. That's one of the thing. So those medications which are given to the patient may wait for, like, what we have a drug called Oriain, a combination of elagolix, so which antagonizes, which works against the estrogen and also the progesterone, so that to prevent the bleeding of those tumors, and also as much reduce the blood supply to those tumors in the system. So also we have gonadotropin releasing hormone antagonists, where we also use to shrink the fibroids. So, and also the major kind of management which we get here in Africa is surgery, where what we call myomectomy is done, where surgeon now decides, like, the patient has severe symptoms, where myomectomy can be done, so that to relieve the patient of those kind of problems. Also, there is a laser surgery where endometrial ablation is done, where the doctor now scraps off those fibroids as he finds them or she finds them, so that we get to do away with the problem. So we also have uterine fibroid embolization, or uterine artery embolization, UAE, where in this procedure a doctor blocks the flow of blood to the fibroids by inserting a gel or a plastic particles into the nearby blood vessels. So normally they do through the big vessels to the small vessel, where they block the supply of blood to the those fibroids, so that to get it non-functional, and that is how you can how that uterine fibroid is done away with. But normally it is expensive, but the most common way which is done here in Africa is surgery, and also embolization of those uterine fibroids sometimes can be done uh, to prevent that. So how can you prevent uterine fibroids? Sometimes if it's genetical, there's not that thing major you can do about it. But if like someone is put like things like overweight, because that is now controllable, where somebody gets to exercise well, if you do good exercise, it really gets to and regulate your weight, you highly get to prevent such kind of problems. So uh, especially on the exercise and getting the earlier treatment. And normally, what the doctors do, like I told you, most of the, in fact, almost all the women have these uterine fibroids, but it depends how I'm sorry for that, problematic they are to that patient, so that the patient gets to be assisted with the doctor, so that they can be removed depending on the situation of the patient, so that the patient can get well. And also these uterine fibroids can cause what we call uh, infertility, which can be a very big problem. Most of the when it is in the infertility level, that's now where the doctor comes in to remove them. If they're removable, because these uterine fibroids, especially the ones which are inside the the lining, the endometrium of the uterus, they really affect the conception or the conception or someone getting pregnant. So the doctor has to intervene by removing them, so that the conception can take place. And also when we have a lot of bleeding, like heavy menses, like we said, because we don't want our patient or a person to lose a lot of blood. So the doctor really advises on getting the patient on the proper treatment, so that we don't get to lose a lot of blood. So most of the time, surgical is the best option, which can really get the patient to the level which the patient is supposed to get. On matters uterine fibroids, we've had a lot of advices and a lot of non-surgical presentation and also teachings on how we are supposed to manage them. But most of the time, you get that the patient waits to waste a lot of maybe treatment, also money and resources, through the people who say maybe they have a herbal way of managing the fibroids. And like we saw, fibroids are tumors, and they really can affect someone and the way for someone functions. So the best way is to see a doctor, a medical doctor, especially the gynecologist, to advise on the best way forward. So this thing of people being told, maybe I have a Chinese drug which can help you, I have this traditional kind of drug which can help you to remove the uterine fibroids, especially when a doctor advises for surgery and someone goes for that such kind of an option. I always find it to be more expensive and more inconvenient for the patient, because of the effects like low blood count, which is anemia, which is most of the time exhibited in the patient. So the best way, the best advice which we can always give those people affected by these leiomyomas or the uterine fibroids is to get a gynecological opinion, get a good ultrasound, get an MRI, and also get the doctor get a proper diagnosis so that the intervention is done in time. These side shows of getting maybe traditional treatment and also other things, getting that Chinese drugs, local drugs, which can take away those fibroids. Sometimes it doesn't, or it is a waste of time most of the time and resources, and it may cost one life, or it may bring more complications to the patient, because the more time you buy for them, the more they grow, because you are within the reproductive age, and also they get to affect that person in a very serious way. So ladies, it is good to take care of your health. We care for you. The doctors are there. Take the doctor's opinion. Maybe if you are not satisfied with the one doctor, it is good to get even 3 opinions on how you're supposed to manage the uterine fibroids if they are there, and the evidence and also the diagnosis is most of the time evident, because when those fibroids are get like you do an ultrasound or you do MRI, they give the length of those things, of those tumors, and they show where they are and how many they are, and the management is always open, is always automatic how they should be managed. So but I think because of the many people who have this complaint, some individuals take advantage of those people they get money from them by saying that they have some special drugs to do something, some miracle, something to happen. Some go to the traditional people, also go to pastor to pray for them, those that they get away with the fibroids, but the problem always remains. And most of the time, when you get a patient that decides now to go the medical way management from the doctor's advice, you get like a patient who came 5 years ago, comes back now with a lot of complications. Now has decided on the doctor's opinion, but sometimes it is too late for the doctor. That's where you get now the doctor even now is now supposed to do what we call hysterectomy, or removing the uterus, and now with the removal of the uterus, that's automatic menopause for that lady, and that also gets to other complications over the same, which are very unnecessary. So doctors' opinions are very important. Take them very seriously, and always take evidence-based kind of advice, because like I said, you get an opinion from Dr. A and B and C, compare the opinions, and also choose the best which works for you at that point. So that is the best we can take care of those kind of things. If you have someone in a family, like I said, maybe in a family, because many people are affected, there's no way you can miss a sister, a aunt, your mother, and someone else who has this problem. So take an appropriate action and advise accordingly, so that we may get to help such kind of people from getting uh, into other problems. Like I said before, the people tell them they can pray for them, that people tell them they can give them other drugs maybe from somewhere else to come and help remove those things. But we found that those things are very complicated at some point, and they're supposed to be managed medically. Guys, welcome to our channel. Kindly, if you have not subscribed, please subscribe, like the video, give a comment down here, and also welcome to our next video. Thank you very much, guys.